Introduction to AI in Medicine. Artificial intelligence, AI, refers to the capability of machines or systems to perform tasks that normally require human intelligence. This includes reasoning, learning from experience, understanding language, and making decisions based on data. In healthcare, AI is proving to be a transformative technology by helping professionals make faster, more accurate decisions in diagnosing, treating, and predicting diseases. It has applications across various fields such as diagnostics, personalized medicine, drug discovery, and surgical robotics. As AI evolves, its potential to improve healthcare outcomes and make treatments more efficient is becoming increasingly apparent. What is artificial intelligence? AI in healthcare is powered by algorithms that can simulate human cognitive functions. Unlike traditional software that requires explicit instructions, AI learns and adapts through data, improving its performance over time. For example, AI can be trained to recognize patterns in medical images, predict patient outcomes, and even recommend personalized treatment plans. Key components of AI in healthcare: machine learning, ML, a branch of AI that enables systems to learn from data. For instance, an ML algorithm trained on patient medical records can identify risk factors for diseases without being explicitly programmed for every specific situation. Natural language processing, NLP. NLP allows AI to understand and interpret human language. In healthcare, this is used to extract useful information from clinical notes, research papers, and medical records. It can be used to streamline administrative tasks or support decision-making by analyzing the vast amounts of unstructured text data in electronic health records, EHR. Robotics. AI is also applied in the field of robotic surgery, where systems like Da Vinci Surgical System use AI to assist surgeons in performing precise, minimally invasive procedures. AI-powered robots can learn from each procedure, enhancing their efficiency and accuracy. Narrow AI versus general AI. Narrow AI is the type of artificial intelligence that exists today in healthcare. It is designed to perform specific tasks, such as diagnosing diseases, analyzing medical images, or recommending treatment plans. These systems excel at solving well-defined problems, but cannot adapt outside the scope of their programming. Example in medicine. AI applications such as Google Health's Mammogram Interpretation System or IBM Watson for oncology are narrow AI models that focus solely on detecting cancer or suggesting treatment plans based on patient data. General AI, also called AGI, Artificial General Intelligence, is theoretical at this stage. It refers to machines that can perform any cognitive task that a human being can do. AGI would have the ability to reason, make judgments, and handle any type of problem solving, much like a human. However, we are still far from achieving AGI, and it remains a long-term goal. Potential in healthcare. If developed, AGI could theoretically take on a broader range of tasks in healthcare, like making medical decisions in highly complex situations, understanding subtle social cues in patient interactions, or even performing entirely new forms of medical research. Historical perspective. AI in healthcare isn't new. Its origins date back to the 1950s and 1960s, when systems like MySyn, developed at Stanford University, were created to assist doctors in diagnosing bacterial infections and recommending antibiotics. The system operated by analyzing medical data and applying a set of predefined rules to arrive at a diagnosis. MySyn was one of the first expert systems, which were AI programs designed to mimic the decision-making abilities of human experts. Early days of AI in medicine. In its infancy, AI was heavily rule-based and required predefined knowledge bases, meaning it could only address a small range of problems. These systems were limited because they couldn't learn from new data or adapt over time. Example, MySyn. MySyn was a rule-based system designed to recommend antibiotic treatments for patients with bacterial infections. While it was able to perform well in controlled scenarios, it didn't have the flexibility to learn from new cases or adapt to new types of infections without manual updates. Modern advancements. The development of machine learning, ML, and deep learning, DL, has transformed AI into a more powerful and adaptable tool. These systems can now analyze vast data sets, ranging from medical images to patient records, to detect patterns and make predictions. For example, AI is now used to detect early signs of cancer or predict patient outcomes using patient data from diverse sources. Impact of big data. In the past, medical practitioners relied on limited data, mostly from physical exams, laboratory tests, and patient histories to make decisions. However, with the advent of big data, the landscape of healthcare has changed. Big data refers to large, complex data sets that are too vast for traditional data processing software to handle. These data sets include patient records, genomics, medical images, wearable sensor data, and more. The scale of data available today allows AI systems to process vast amounts of information at incredible speeds, identifying patterns and correlations that would otherwise go unnoticed. Healthcare data explosion. Today, healthcare data is growing exponentially. Hospitals generate millions of data points daily, ranging from diagnostic tests and treatments to genomic sequences and patient-reported outcomes. In fact, it's estimated that healthcare data is expected to grow to 2,314 exabytes by 2025. AI's role in managing big data. AI's ability to process and interpret these vast data sets is crucial. For example, AI models can combine data from multiple sources, such as electronic health records, EHRS, medical imaging, and genomics, to create a more holistic view of a patient's health. This enables earlier detection of diseases, more personalized treatments, and better predictions of future health risks. Example: the All of Us research program initiated by the U.S. National Institutes of Health, NIH, collects large amounts of genetic, environmental, and health data from diverse populations. AI is used to analyze this data and identify new patterns that could lead to breakthroughs in precision medicine. Improved decision-making. By utilizing big data, AI can assist healthcare professionals by offering insights that would be impossible to uncover manually. For example, AI might identify subtle patterns in a patient's medical history that suggest an increased risk of developing a specific disease years before it manifests clinically. Multimodal AI. The future of AI in medicine isn't just about analyzing one type of data in isolation. It's about combining and integrating multiple forms of data to enhance diagnostic accuracy and make more informed decisions. This is called multimodal AI, which refers to AI models that can analyze data from multiple sources simultaneously, such as medical images, laboratory test results, patient history, and genetic data. What is multimodal AI? Multimodal AI is designed to integrate and process diverse data inputs. For example, a healthcare AI system might analyze an MRI scan, image data, genetic test results, genomic data, and patient-reported outcomes, textual data from surveys or medical records, to provide a more comprehensive diagnosis. Why is it important? Combining different types of data provides a more accurate and complete picture of a patient's health. Humans often struggle to process multiple data streams at once, but multimodal AI can seamlessly analyze diverse inputs to identify complex relationships between them. Example: predicting disease. Progression, a multimodal. AI system might analyze a patient's genetic data alongside imaging results to predict how fast a disease, such as cancer, will progress. This holistic view allows for earlier intervention and more precise treatment. Case study: DeepMind and AlphaFold. DeepMind, an AI research company owned by Google, developed AlphaFold, an AI system that predicts protein folding. The discovery of how proteins fold is one of the most complex problems in biology. AlphaFold uses multimodal approaches to combine data from genetic sequences and known protein structures, improving our understanding of diseases like Alzheimer's and cancer. Impact on clinical practice. As multimodal AI evolves, it could lead to more personalized, data-driven treatment regimens. For instance, An AI system could analyze all aspects of a patient's medical profile, genetic, historical, and real-time data, to predict the optimal treatment plan, reducing the trial and error process that is often involved in healthcare. The future of multimodal AI in medicine. The future of multimodal AI in medicine holds the potential to transform healthcare in ways that were once unimaginable. The convergence of multiple AI-driven technologies and diverse types of data, for example, medical imaging, genomic data, patient histories, and real-time health monitoring, promises to improve diagnostics, create personalized treatment regimens, and streamline healthcare processes. How multimodal AI will revolutionize healthcare. Better disease. Diagnosis. Multimodal AI models are capable of analyzing a wide range of data sources, including medical images, patient history, laboratory results, and genetic data. By integrating these various data types, AI can provide a more holistic view of a patient's condition, which will lead to more accurate diagnoses. For example, a multimodal AI system could analyze a patient's MRI scan, imaging data, genomic data from a blood test, and clinical notes, text data, to identify early-stage cancer that might be missed by a radiologist focusing on the imaging alone. Personalized treatment plans. Personalized medicine is one of the greatest promises of multimodal AI. By incorporating genetic, environmental, and lifestyle data, AI models can help develop treatment plans tailored specifically to an individual's needs. This is a shift away from the one-size-fits-all approach to medicine. Example: in cancer care, multimodal AI systems could evaluate both the genetic profile of a patient's tumor and its molecular markers, alongside traditional imaging and clinical data. With this comprehensive view, the system could suggest personalized therapies that have a higher chance of success, minimizing the trial and error process. Predicting disease progression. One of the most exciting aspects of multimodal AI is its ability to predict the progression of diseases over time. By analyzing historical data on how diseases evolve in similar patient populations and incorporating real-time data, for example, wearable sensors or biomarker levels, AI can forecast how a patient's condition might develop. This allows for proactive, rather than reactive, healthcare. Example, in patients with chronic conditions like heart disease, AI could analyze changes in biomarkers, medication adherence, and lifestyle factors, for example, exercise diet, to predict when a patient is at risk for a heart attack or stroke. Improving efficiency and reducing costs. With the ability to process vast amounts of data quickly and accurately, multimodal AI can help reduce inefficiencies in healthcare systems. By automating repetitive tasks, assisting in diagnostic decisions, and offering personalized treatment recommendations, AI can help healthcare providers focus on more critical aspects of patient care, thus reducing overall healthcare costs. Example: multimodal AI could assist in triaging emergency room patients by analyzing both their medical history and real-time data from sensors, for example, heart rate, blood oxygen levels, to prioritize patients with the most urgent needs, reducing wait times and improving resource allocation. Enhancing clinical decision support. AI can function as a decision support system by synthesizing and analyzing large amounts of clinical data. This means healthcare providers can access evidence-based insights that are customized to the patient's unique situation. This support can lead to better treatment choices and improved patient outcomes. Example: an AI system could combine real-time patient data with knowledge from clinical research to suggest the most effective treatments for rare diseases, which may not be immediately familiar to every healthcare provider. Collaboration between AI and human expertise. The future of healthcare with multimodal AI is not about replacing clinicians. Rather, it's about creating a collaboration where AI supports healthcare professionals by providing insights, predictions, and analysis that enhance human judgment. Healthcare providers will act as the final decision makers, with AI acting as a powerful tool in their arsenal. Example: in the future, an oncologist might use a multimodal AI system that analyzes the patient's tumor images, genetic data, and lifestyle factors to create a personalized treatment plan. The oncologist will consider this information alongside their clinical expertise to make the final decision, thereby enhancing the accuracy and effectiveness of the treatment. Real-world AI application. Example, IBM Watson Health. IBM Watson Health was one of the first major attempts to integrate AI into clinical practice on a broad scale. The platform uses machine learning and natural language processing to analyze vast amounts of medical literature, clinical trial data, patient records, and other health data to assist healthcare providers in making decisions. IBM Watson for Oncology. IBM Watson for Oncology is a prime example of applying AI to cancer treatment. The system is designed to assist oncologists by providing evidence-based treatment recommendations tailored to each individual patient's data. The system analyzes patient records, including demographic information, medical history, and genetic data, alongside a huge database of clinical trials and research articles to suggest potential treatment options. Functionality of Watson for Oncology. Watson for Oncology sifts through thousands of medical papers, clinical trial results, and treatment guidelines to provide oncologists with evidence-backed treatment options for patients. The system considers the genetic profile of the tumor, patient health records, and current guidelines to recommend treatments that have the best chances of success for each individual. Real-world example. Watson for Oncology was deployed in several hospitals around the world, including partnerships with hospitals in India and the United States. In one study at Memorial Sloan Kettering Cancer Center, Watson for Oncology provided treatment recommendations that were concordant with those made by a panel of human oncologists 93% of the time, illustrating the potential of AI to assist clinicians in making fast, informed decisions. Challenges of Watson for Oncology. Despite its promise, Watson for Oncology has faced several challenges in clinical implementation that highlight the complexities and limitations of AI systems in healthcare. Discrepancies in recommendations. While Watson for Oncology has shown promise in providing accurate treatment recommendations, there have been cases where its suggestions did not align with clinical reality. For example, some oncologists reported that Watson occasionally recommended treatments based on incorrect or incomplete data, which could lead to misdiagnoses or unnecessary treatments. Example: in 2018, the New York Times reported that Watson for Oncology occasionally gave treatment suggestions that were not always aligned with best practices in oncology, such as recommending a chemotherapy regimen when a less invasive option might have been more appropriate for the patient. Data quality issues. The accuracy of AI systems like Watson for Oncology relies heavily on the quality of the data they are trained on. If the training data is incomplete, biased, or not representative of the full range of patient cases, the AI system may struggle to provide accurate recommendations. Example: if Watson was trained primarily on data from one hospital or geographic region, it might not be as effective in other regions with different patient demographics or treatment practices. Integration into clinical workflow. Integrating AI into existing healthcare systems is a significant challenge. Watson for Oncology, like many AI systems, needs to seamlessly integrate into clinical workflows. However, many healthcare providers were initially reluctant to trust AI-driven systems for critical decision-making, particularly for something as sensitive as cancer treatment. Additionally, clinician training was required to understand and effectively use the technology. Example: some healthcare providers found that integrating Watson into their clinical workflows took longer than expected due to challenges in data transfer, user interfaces, and how Watson's recommendations were presented to clinicians. The system was sometimes seen as an additional burden rather than a helpful tool. AI as a complementary tool, not a replacement. One key challenge that Watson has highlighted is the importance of treating AI as a complementary tool rather than a replacement for human expertise. AI systems like Watson are most effective when used to augment the judgment of healthcare professionals, providing insights and supporting decision-making. They are not intended to replace the nuanced understanding and experience of clinicians. Solution: Watson for Oncology and other similar AI platforms must evolve to work in collaboration with clinicians, offering insights that they can validate and interpret in the context of individual patient needs. Regulatory and ethical concerns. Another issue is the regulatory environment surrounding AI in healthcare. Ensuring that AI systems are validated and meet ethical standards is crucial to their success in clinical environments. Questions about accountability, patient consent, and bias in AI recommendations must be addressed in order to gain widespread acceptance. Example: regulatory agencies like the FDA are now involved in the process of certifying AI tools for medical use, but the evolving nature of AI technology makes this a challenging task. Furthermore, ethical concerns about bias in AI models remain a hot topic in the healthcare industry. Summary: the future of multimodal AI in medicine promises a paradigm shift in how diseases are diagnosed, treated, and managed. As multimodal AI systems become more advanced, healthcare providers will be able to make more accurate, personalized decisions, leading to better patient outcomes and reduced healthcare costs. IBM Watson for Oncology illustrates the power of AI in supporting oncologists with personalized treatment recommendations. However, the challenges Watson has faced, including discrepancies in recommendations, data quality issues, and the need for AI to complement. Section 1. Current applications. AI in medical imaging, expanding the role of deep learning. AI in medical imaging has become one of the most powerful tools for improving the accuracy, speed, and efficiency of diagnoses. The use of deep learning, DL, in medical imaging is transforming the way healthcare providers detect and analyze diseases by automating and enhancing the interpretation of medical images. Let's delve deeper into how deep learning works in medical imaging, the various applications in healthcare, and the success stories of AI integration. Deep learning for diagnostic imaging. How deep learning works in medical imaging. At the heart of AI in medical imaging is deep learning, a subset of machine learning that involves training artificial neural networks to recognize intricate patterns in large data sets. Deep learning is particularly suited for analyzing complex, unstructured data like medical images, where subtle differences can signify significant clinical findings. AI models are trained to learn the features of these images and detect abnormalities such as tumors, fractures, and lesions. The training process of deep learning models. The foundation of deep learning in medical imaging is the training process, which requires large sets of labeled data to teach the AI system to recognize patterns. This involves feeding the AI algorithm thousands or even millions of labeled images, those that are already annotated with the correct diagnoses. For example, whether the image depicts a cancerous lesion or healthy tissue. The process works as follows. Data input. The neural network is shown thousands of medical images, such as CT scans, MRIs, X-rays, and mammograms. Each image is paired with labels that provide information about the presence of disease, for example, lung cancer, benign tumor, fracture, or healthy tissue. Layered learning. Deep learning uses multiple layers of algorithms, hence deep, to extract features from the images. The system first identifies simple patterns, for example, edges, shapes, and gradually learns more complex structures, for example, the overall shape of a tumor or the distortion caused by a fracture. Feedback and adjustments. As the algorithm identifies patterns, it makes predictions. If its prediction is incorrect, the system adjusts its internal parameters, such as the weights of neural connections, through an iterative process called backpropagation. This allows the algorithm to improve its performance over time, becoming more accurate in detecting specific abnormalities. How AI learns. The neural network is built to simulate the way the human brain processes information. By adjusting weights based on the error between its predictions and the true labels, via a process known as supervised learning, the AI gradually becomes better at distinguishing between healthy and abnormal images. Over time, with enough training, the model can identify diseases more accurately than human experts in certain cases. Advanced techniques in deep learning. One of the advanced techniques used in medical imaging is convolutional neural networks, CNNS. CNNS are especially effective for analyzing images as they can automatically detect spatial hierarchies in the data. CNNS are designed to recognize features like edges, textures, and shapes, which are critical in diagnosing diseases in medical images. Key applications of AI in imaging. Lung cancer detection. One of the most notable applications of AI in medical imaging is the detection of lung cancer. Chest X-rays and CT scans are the primary imaging tools used to diagnose lung cancer, but early-stage tumors can be difficult to detect due to their small size and subtle appearance in imaging. AI enhances early detection. AI systems can be trained to analyze chest X-rays or CT scans to detect abnormalities such as nodules or masses in the lungs, which are often indicative of lung cancer. AI's strength lies in its ability to identify patterns in these images that might not be immediately visible to human eyes. This capability is particularly useful in detecting early-stage lung cancer, when the disease is still treatable and more likely to be curable. Study example. A study published in Nature Medicine demonstrated that an AI model could outperform radiologists in detecting lung cancer in CT scans. The AI algorithm correctly identified early-stage lung cancer with a sensitivity rate of over 94%, compared to 88% for human radiologists. The system could also help in identifying false negatives when a tumor is missed, which is critical in improving early diagnosis. Impact on lung cancer mortality. Early detection through AI-driven analysis can lead to quicker intervention and improved outcomes for lung cancer patients. Given that lung cancer is the leading cause of cancer-related deaths worldwide, the use of AI to catch it earlier can significantly reduce mortality rates. Breast cancer detection. Another key area where AI has made a huge impact is in breast cancer detection. Mammograms have long been the gold standard for detecting breast cancer, but interpreting mammograms can be challenging and prone to human error. AI improves accuracy. AI systems, such as Google Health's Mammography AI, have been developed to assist radiologists in identifying potential signs of breast cancer. These systems are trained using large data sets of mammogram images that are labeled with the correct diagnoses. By analyzing the images, AI can spot subtle changes in tissue that may indicate cancerous growths, even in early stages when they are more treatable. Study example. In 2020, a study published in JAMA showed that AI-based systems like Google Health's Mammography AI outperformed human radiologists in breast cancer detection. In a cohort of over 25,000 mammograms, the AI model detected cancer with higher accuracy and resulted in fewer false positives, incorrectly identifying healthy tissue as cancerous, compared to traditional methods. This is crucial because false positives often lead to unnecessary biopsies and patient anxiety. Benefits of AI in breast cancer. Screening. By reducing false positives and improving detection rates, AI in mammography could not only improve patient outcomes, but also reduce the strain on healthcare systems. Fewer unnecessary procedures would mean lower costs and more efficient use of resources. Radiology workflow automation. In addition to diagnostic applications, AI is transforming the radiology workflow, making it more efficient and responsive to patient needs. AI systems can automate various steps in the process, from image acquisition to prioritization, and even final interpretation. Prioritization of critical cases. AI can be used to analyze incoming medical images and flag cases that require immediate attention. For example, in emergency rooms, patients who are suspected of having a brain hemorrhage or stroke need rapid intervention. AI can analyze CT scans and immediately highlight the most critical cases, ensuring that they are prioritized for examination by human radiologists. Improving efficiency, AI also helps reduce the workload of radiologists by automating more routine tasks. This allows radiologists to focus on more complex cases and make faster decisions. AI can detect anomalies such as fractures, tumors, or organ abnormalities without the need for human intervention. This makes the overall workflow much more efficient and effective. AI in large-scale imaging. In hospitals and clinics with large imaging volumes, AI can handle the initial image analysis and flag suspicious findings, which can be reviewed later by radiologists. This greatly reduces the time needed to diagnose and triage large numbers of patients. Success story: Path AI for pathology. One of the standout success stories in the application of deep learning in medical imaging comes from Path AI, a company focused on using AI to assist pathologists in diagnosing diseases from pathology slides. Path AI's technology uses deep learning to help analyze tissue samples and detect anomalies like cancerous cells or inflammatory conditions. Path AI's impact in breast cancer diagnosis. In breast cancer pathology, Path AI's system was shown to outperform human pathologists in diagnosing cancerous tissue. In a study involving breast cancer diagnosis, Path AI's deep learning model demonstrated greater accuracy than human pathologists in classifying tumor tissue. The AI model was able to correctly classify benign and malignant tissue with a higher level of precision, which is crucial for accurate diagnosis and treatment planning. Reducing diagnostic errors. Path AI's system helps reduce diagnostic errors, particularly in complex cases, where subtle changes in tissue might be overlooked by human eyes. By accurately identifying and classifying tumor tissue, Path AI can provide pathologists with a second opinion, ensuring that no critical details are missed. Streamlining pathology. Workflows. Path AI not only improves accuracy, but also accelerates the overall workflow in pathology labs. The AI system can process slides more quickly than human pathologists, providing faster results to physicians and patients. This is especially important for patients who need quick diagnoses for timely treatment decisions. Conclusion: AI in medical imaging, especially through deep learning, is reshaping the landscape of medical diagnostics. From detecting lung cancer and breast cancer to streamlining radiology workflows and improving pathology diagnoses, AI is enhancing both the accuracy and speed of healthcare. The success stories of Path AI and the ongoing advancements in deep learning for mammography and CT scans show that AI is already providing tangible improvements in patient care, and its potential continues to expand. By automating repetitive tasks, detecting abnormalities early, and aiding in complex diagnoses, AI in medical imaging is paving the way for more efficient and precise healthcare systems. As AI technology continues to evolve, it will likely become an indispensable tool for medical professionals, helping them provide better care for their patients. AI in predictive analytics, transforming healthcare with data-driven forecasts. AI in predictive analytics is revolutionizing the way healthcare professionals approach disease prevention, chronic disease management, and overall patient care. Predictive analytics leverages advanced algorithms to analyze large volumes of patient data, identifying trends and patterns that can forecast future health outcomes. This ability to predict the course of a disease or the likelihood of a patient experiencing certain health events gives healthcare providers the opportunity to intervene proactively, often before a condition worsens. Let's delve deeper into the applications of AI in predictive analytics, particularly in disease progression and chronic disease management, and explore a real-world success story. How AI can predict health outcomes. AI's potential to predict health outcomes relies on its ability to process massive datasets from a variety of sources, including patient history, genetic information, lifestyle factors, and real-time health metrics. The ability to leverage this data enables AI to identify patterns, predict future conditions, and recommend timely interventions. Predicting disease progression. One of the most significant applications of AI in predictive analytics is its ability to forecast disease progression. Traditional healthcare models often rely on periodic checkups and diagnostics to track the progression of diseases, but AI can analyze real-time data to predict how a patient's condition will evolve, enabling earlier intervention. AI and risk prediction. AI models can analyze a patient's demographic and clinical data to estimate the likelihood of developing certain diseases. For example, AI can predict a patient's risk of type 2 diabetes or cardiovascular disease by assessing factors such as age, Older individuals are generally at higher risk for many chronic conditions. Weight and body mass index, BMI. Obesity is a major risk factor for diseases like diabetes and heart disease. Family history. A patient's family history of diseases like cancer or heart disease can indicate a genetic predisposition. Lifestyle factors. Factors such as diet, physical activity, smoking, and alcohol consumption all influence a person's risk. Biomarkers. AI can assess laboratory results and genetic data, identifying early signs of disease. Example: a machine learning algorithm might use a combination of age, family history, cholesterol levels, and other factors to predict whether a patient is likely to develop heart disease within the next 5 years. Early prediction enables healthcare providers to suggest preventive measures such as lifestyle changes, medications, or more frequent monitoring. Disease onset prediction. Predicting the onset of diseases like Alzheimer's, Parkinson's, or type 2 diabetes before symptoms appear is another area where AI excels. By analyzing genetic markers, biomarkers, and environmental factors, AI can predict the likelihood of these diseases developing, even in asymptomatic patients. Example: in Alzheimer's disease, AI models can analyze MRI scans of the brain alongside genetic data, such as the presence of the APOE4 gene, to predict whether a person will develop the disease in the future. Early detection allows for the administration of preventive treatments or lifestyle interventions that can delay or slow the disease's progression. Predicting disease outcomes. AI is also useful for predicting disease outcomes, such as how a cancer patient will respond to treatment or how likely they are to survive a particular type of cancer. By analyzing data from previous patients with similar conditions, AI models can generate predictions about treatment effectiveness, survival rates, or the likelihood of remission. Example: in cancer care, AI models can analyze large datasets from clinical trials and patient outcomes to predict how a patient will respond to a specific chemotherapy drug. This can help oncologists tailor treatments to maximize effectiveness while minimizing side effects. AI in chronic disease management. Chronic diseases, such as diabetes, heart disease, and chronic obstructive pulmonary disease, COPD, require continuous monitoring to manage effectively. AI plays a crucial role in chronic disease management by analyzing real-time data from wearables and medical devices, alerting healthcare providers to potential issues before they become critical. Real-time monitoring. Wearable devices such as smartwatches, blood glucose monitors, and blood pressure cuffs are equipped to collect a wide range of health data continuously. AI can analyze this real-time data, detecting any irregularities or patterns that suggest a patient's condition may be deteriorating. Example: AI-driven systems can monitor a diabetic patient's blood glucose levels in real time and predict when the patient is at risk of experiencing a hypoglycemic event. The system could send an alert to the patient or their healthcare provider, enabling immediate intervention to prevent a dangerous drop in blood sugar. Predicting exacerbations and hospital readmissions. I can also predict exacerbations in chronic conditions like asthma or COPD, which are often triggered by changes in environment or activity levels. For example, AI models can predict when a patient with COPD is at risk of an acute exacerbation based on changes in respiratory rate, oxygen saturation, and heart rate. Early prediction enables healthcare providers to initiate preventive measures, such as adjusting medications or suggesting lifestyle changes to avoid hospital admissions. Example: a system using remote monitoring could alert healthcare providers when a patient with heart failure is at risk of hospitalization due to fluid retention. The system might flag changes in the patient's weight, blood pressure, or heart rate, allowing the provider to intervene with a medication adjustment or more frequent check-ins. Enhancing treatment adherence. One of the greatest challenges in managing chronic diseases is ensuring patients adhere to their treatment regimens. AI can be used to send reminders to patients to take their medications or follow through with prescribed lifestyle changes. By analyzing patient behavior, AI can even predict when a patient is likely to skip medications or miss appointments, prompting proactive follow-ups by healthcare providers. Example: for a patient with hypertension, an AI system can remind them to take their medications, track their blood pressure readings, and alert the provider if the readings remain high for an extended period. By doing so, AI helps ensure that treatment is consistent and effective. Success story: Health Catalyst's predictive analytics platform. Health Catalyst is a healthcare technology company that provides data and analytics services to improve healthcare delivery. Its predictive analytics platform has been instrumental in helping hospitals reduce readmissions and improve patient outcomes by leveraging the power of AI to identify high-risk patients. How Health Catalyst's platform works. Health Catalyst's predictive analytics platform uses machine learning algorithms to analyze a variety of patient data, including medical histories, lab results, clinical observations, and demographic information. By identifying patterns and trends in this data, the platform can generate risk scores for individual patients, helping healthcare providers prioritize care for those at the highest risk. For example, the platform can predict the likelihood of a patient being readmitted to the hospital within 30 days after discharge. This allows the care team to intervene early, whether by adjusting the treatment plan, providing additional support, or offering follow-up care that reduces the risk of complications or readmissions. Impact on reducing readmissions. One of the key benefits of Health Catalyst's platform is its ability to reduce hospital readmissions, which are a major concern for healthcare providers due to their high costs and impact on patient outcomes. AI models can identify patients who are at a higher risk of being readmitted and trigger interventions to reduce that risk. Example: a patient who has recently undergone heart surgery may be flagged as at high risk for readmission due to factors like a history of heart failure, poor medication adherence, or difficulty following post-discharge care instructions. By identifying this risk early, the platform enables the healthcare provider to schedule follow-up visits or provide additional resources to ensure the patient stays on track with recovery. Improving patient outcomes. Health Catalyst's platform doesn't just focus on reducing readmissions, it also aims to improve overall patient outcomes by providing insights into the most effective treatment options. By analyzing data from past patient outcomes, the platform can help healthcare providers make more informed decisions about treatment plans and interventions, improving patient care in the long term. Example: if the AI identifies that a particular medication or intervention has been highly effective for patients with a similar condition, healthcare providers are more likely to use that treatment for their current patients, increasing the likelihood of positive outcomes. Conclusion: AI's role in predictive analytics. AI in predictive analytics is reshaping the way healthcare providers make decisions. From predicting disease progression and improving chronic disease management to enhancing patient outcomes through early intervention, AI has become an essential tool in modern medicine. As AI continues to evolve, its ability to predict and prevent health issues before they escalate will lead to more personalized, proactive, and efficient healthcare systems. The success stories of companies like Health Catalyst demonstrate how AI-driven platforms are not only improving the quality of care, but also reducing the burden on healthcare systems by preventing avoidable complications and hospital readmissions. In the future, predictive analytics will continue to be a game changer, allowing healthcare providers to make data-driven decisions that improve patient care and reduce costs, ultimately saving lives and optimizing healthcare delivery. AI in personalized medicine, advancing treatment through precision. The integration of artificial intelligence, AI, into personalized medicine is a groundbreaking development in healthcare. This approach tailors medical treatment to the individual characteristics of each patient, particularly their genetic profile. With AI's ability to analyze vast amounts of data and identify key patterns, healthcare providers can offer more targeted therapies, improving the efficacy of treatments while minimizing harmful side effects. Let's explore how AI is transforming personalized medicine, particularly in genomics, pharmacogenomics, and through real-world success stories like Tempus. Genomics and AI, unlocking the secrets of the genome. How AI analyzes genetic data. Genomics is the study of an individual's genetic makeup, which can provide valuable insights into their susceptibility to certain diseases, how their body may respond to treatments, and potential risks for developing chronic conditions. With AI's ability to process and interpret enormous datasets, genomic analysis has entered a new era of precision. Genetic sequencing and data analysis. Genetic sequencing involves reading the DNA of an individual to identify variations, mutations, and specific markers that can predispose a person to disease. AI models excel in parsing through the millions of data points generated by next-generation sequencing, NGS, which provides a detailed map of a person's genes. AI algorithms are trained to identify genetic variants linked to various diseases, including cancers, cardiovascular conditions, and rare genetic disorders. Mutation detection and interpretation. Through the analysis of large-scale genetic data, AI can pinpoint mutations, both germline, inherited, and somatic, acquired, that may predispose patients to conditions like breast cancer, Alzheimer's disease, or diabetes. These mutations can have a significant impact on how the body processes environmental factors, makes proteins, and carries out biological functions. Example, in the case of BRCA1 and BRCA2 gene mutations, which increase the risk of breast and ovarian cancers, AI can detect these mutations early through genetic testing, alerting healthcare providers to offer preventive measures like early screening or preventive surgeries. Tailored treatment plans. By understanding the genetic makeup of an individual, AI can help design personalized treatment plans that are tailored specifically to their unique genetic profile. For example, if a patient carries a mutation known to make them susceptible to a specific drug's side effects, AI can adjust the treatment plan to either change the medication or customize the dose, leading to safer and more effective treatments. Example, AI can analyze the genetic makeup of a cancer patient and identify mutations that might make their tumor resistant to certain chemotherapy drugs. AI can then suggest alternative drugs or combination therapies that are more likely to be effective based on the patient's genetic variations. Genetic data and disease prediction. AI models can predict how likely a patient is to develop certain diseases based on their genetic data. For example, AI can analyze genetic variations associated with a predisposition for conditions like heart disease or diabetes. By doing so, AI can help initiate early interventions and lifestyle changes to reduce the risk of these diseases. Example, a patient with a family history of Alzheimer's disease and certain genetic markers, such as the APOE4 gene, could be flagged by AI systems for early screening and possible enrollment in clinical trials for preventive treatments. Pharmacogenomics, AI in drug response prediction. What is pharmacogenomics? Pharmacogenomics is the study of how an individual's genetic makeup influences their response to drugs. This field combines genomics and pharmacology to tailor medication regimens based on the patient's genetic profile. AI plays a critical role in pharmacogenomics by predicting which drugs will be most effective for a patient based on their unique genetic makeup, and by identifying potential adverse reactions before they occur. AI in pharmacogenomics, how it works. Genetic variations and drug metabolism. One of the key factors in pharmacogenomics is understanding how genetic variations can influence the metabolism of drugs. For instance, some people metabolize certain medications more quickly, while others may metabolize them too slowly, resulting in either ineffectiveness or toxic buildup in the body. Example, genetic variations in the CYP450 gene family can influence how drugs like warfarin, a blood thinner, or statins, cholesterol-lowering drugs, are metabolized. AI can predict the optimal drug dose for a patient based on these variations, minimizing adverse reactions. Cancer and drug sensitivity. In oncology, AI plays a pivotal role in predicting how a cancer patient will respond to chemotherapy or targeted therapies. Cancer cells often have mutations that make them either more susceptible or resistant to specific drugs. By analyzing the genetic profile of a patient's tumor, AI can predict which treatment will be most effective, offering a personalized therapy plan. Example: in breast cancer treatment, the presence of specific genetic mutations like HER2 amplification can determine whether a patient will benefit from Herceptin, trastuzumab, a targeted therapy. AI can analyze the genetic sequencing of the tumor to assess HER2 status and recommend the appropriate therapy. Minimizing side effects. AI models are capable of predicting adverse drug reactions, ADRs, based on a patient's genetic variations. This is especially important for patients who have experienced negative reactions to standard medications in the past. By analyzing large data sets of genetic, pharmacological, and clinical data, AI can predict which drugs may be problematic for certain individuals. Example: AI can be used to predict pharmacogenetic interactions, where a specific genetic variant might increase the risk of severe side effects when a patient takes certain medications. For example, patients with certain genetic variants may be at a higher risk of adverse reactions to chemotherapy drugs, like fluorouracil or oxaliplatin. AI can help guide the healthcare provider to adjust the treatment regimen accordingly. Success story: Tempus, AI-powered personalized oncology care. Tempus is a leader in applying AI to personalized oncology care. The company uses AI to analyze both clinical data and molecular data to offer individualized treatment plans, improving patient outcomes in cancer care. Tempus, personalized oncology care. Through AI, genetic sequencing and data analysis. Tempus uses genetic sequencing to identify mutations in a patient's tumor, providing a deep understanding of the tumor's genetic profile. This allows Tempus to suggest the most effective treatments, whether it's a specific chemotherapy drug, a targeted therapy, or enrollment in a relevant clinical trial. Example: if a breast cancer patient has a mutation in the BRCA1 gene, Tempus can help determine if they would respond to PARP inhibitors, a class of drugs that target cancers with specific genetic mutations. AI algorithms analyze the tumor's molecular data to recommend the most effective therapies. Clinical trials and AI-driven insights. Tempus also uses AI to match patients with clinical trials that might be the most beneficial for their specific genetic makeup. The platform analyzes both genetic mutations and clinical histories to identify trials that are most likely to offer effective results for each patient. Example: a patient with a rare form of lung cancer may not respond well to conventional treatments, but Tempus can use AI to identify ongoing clinical trials for new therapies or targeted treatments that align with their specific genetic mutation. Improving survival rates. By utilizing both clinical data and genomic information, Tempus's platform helps oncologists make more informed decisions, ultimately improving patient survival rates. In some cases, the platform has helped identify previously unknown treatment options that offer better outcomes than traditional therapies. Example: in a patient with metastatic melanoma, Tempus may suggest an immunotherapy treatment based on specific genetic markers, improving the chances of remission or prolonged survival. Data integration and real-time decision-making. Tempus AI platform integrates data from various sources, for example, genetic sequencing, clinical records, imaging data, to provide real-time recommendations for treatment. This holistic view enables healthcare providers to offer highly personalized and data-backed treatment plans for cancer patients. Example: the AI-driven recommendations are designed to be easily interpretable by oncologists, who can quickly incorporate this information into their clinical decision-making, ensuring timely and precise treatment decisions. Conclusion: the future of AI in personalized medicine. AI is paving the way for the future of personalized medicine, offering a level of precision and efficiency that was previously unimaginable. By integrating genetic data, pharmacogenomics, and advanced algorithms, AI is allowing healthcare providers to tailor treatments specifically to each patient's genetic makeup, biological processes, and environmental factors. This approach is not only improving the effectiveness of treatments, but also reducing the risk of adverse side effects and preventing unnecessary procedures. Success stories like Tempus exemplify the transformative power of AI in personalized oncology care, offering real-world evidence of how AI can improve patient outcomes, reduce healthcare costs, and enable more precise, data-driven treatment decisions. As AI continues to evolve, its role in genomics, drug response prediction, and disease management will undoubtedly expand, ushering in a new era of precision healthcare that is more tailored, effective, and accessible than ever before. AI in drug discovery, revolutionizing the search for new treatments. The process of drug discovery has traditionally been long, expensive, and fraught with uncertainty. However, the integration of artificial intelligence, AI, into drug discovery is fundamentally changing this landscape. AI models can process vast amounts of data, identify patterns, and predict outcomes with precision, making the drug development process faster, more efficient, and potentially more successful. Let's explore how AI is transforming the field of drug discovery by predicting molecular interactions, optimizing clinical trial designs, and repurposing existing drugs. AI's role in accelerating drug development. AI is revolutionizing drug discovery by automating and enhancing multiple stages of the process. From identifying drug candidates to designing clinical trials, AI's ability to analyze large datasets quickly and accurately is streamlining workflows, reducing costs, and increasing the likelihood of discovering effective treatments. Predicting molecular interactions, identifying promising drug candidates. One of the primary roles of AI in drug discovery is predicting how chemical compounds interact with biological targets. This is essential because the success of a new drug depends largely on its ability to bind to and affect specific proteins, enzymes, or receptors in the body. Traditional drug discovery methods often rely on labor-intensive, high-throughput screening and trial-and-error experiments, which can be slow and expensive. AI-driven molecular docking. Molecular docking is the process of simulating how small molecules, like drugs, interact with biological targets at the molecular level. AI models are able to predict the binding affinity between a drug candidate and its target more efficiently than traditional methods. By analyzing molecular structures and using machine learning algorithms to simulate potential interactions, AI can predict how well a drug will bind to its target and how likely it is to produce a therapeutic effect. Example: AI models like those used by in silico medicine have been employed to predict how drug molecules interact with viral proteins in diseases like COVID-19. These AI systems can quickly screen thousands of potential drug compounds to identify the most promising candidates that may be effective against the virus. Quantifying drug target affinity. Beyond identifying potential drug candidates, AI can also estimate the binding affinity between a drug and its biological target, helping researchers prioritize which compounds should move forward in development. This reduces the need for extensive wet lab testing of compounds that are unlikely to be successful, saving time and resources. Example: AI-based platforms like DeepMind's AlphaFold have demonstrated the ability to predict the 3D structure of proteins accurately, providing essential insights for drug design. By understanding how proteins fold and interact with drug molecules, researchers can design drugs that are more effective and have fewer side effects. Predicting drug toxicity. AI can also predict potential toxicity issues with drug candidates. Using historical data from previous drug development trials, AI models can identify chemical structures or compounds that are more likely to cause adverse reactions. This early identification of toxicity allows researchers to refine or discard compounds that may be harmful, significantly reducing the risk of failure later in the development process. Example: AI tools can analyze the molecular structure of drug candidates and compare them against known toxicity data from previous compounds, identifying potential issues with liver toxicity, cardiac toxicity, or other organ-specific side effects. AI in clinical trial design, optimizing patient selection and trial efficiency. Once a promising drug candidate has been identified, it must undergo rigorous testing in clinical trials. AI plays a crucial role in optimizing this phase by analyzing patient data and designing more efficient trials. The traditional clinical trial process can be costly and time-consuming, often taking years to complete. AI's ability to predict patient responses and optimize trial parameters is significantly speeding up this process. Patient selection. One of the major challenges in clinical trials is identifying the right patient population for a particular treatment. AI can analyze genetic data, medical histories, demographic information, and previous trial results to identify which patients are most likely to benefit from a specific drug. By selecting the appropriate patients, clinical trials can produce more reliable results and require fewer participants, reducing the trial duration and cost. Example: AI systems can analyze genomic and clinical data from cancer patients to determine which patients are more likely to respond to targeted therapies. By enrolling only those patients who meet certain genetic criteria, AI can help create more homogeneous trial groups, increasing the chances of detecting meaningful results. Optimizing trial design. AI can also be used to optimize the design of clinical trials by predicting the most effective dosages, identifying potential biomarkers for patient monitoring, and determining the ideal timing for drug administration. By analyzing historical trial data, AI can identify patterns that can improve future trial designs. Example: AI-driven models can predict the optimal dosage of a new drug based on the patient's genetic profile and their metabolism, reducing the trial duration by eliminating the need for multiple dose-finding phases. This allows the trial to move quickly to testing efficacy and safety in a broader population. Real-time monitoring and adaptation. During clinical trials, AI systems can provide real-time monitoring and analyze patient data to detect early signs of adverse effects or inefficacy. This allows researchers to adapt trial protocols dynamically, either by adjusting dosages, modifying the trial structure, or stopping the trial early if the drug is proven to be ineffective or unsafe. Example: in the context of oncology trials, AI can analyze patients' real-time data, such as tumor growth and gene expression levels, to adjust treatment regimens based on individual responses. This adaptive trial design ensures that resources are spent efficiently and allows for faster identification of effective therapies. Success story: Benevolent AI. AI in drug repurposing. Benevolent AI is a prime example of a company successfully integrating AI to accelerate drug discovery and repurpose existing drugs for new uses. Benevolent AI's platform leverages machine learning algorithms to analyze vast data sets, including scientific literature, clinical data, and genomic information, to identify new potential treatments for rare diseases and conditions that lack effective therapies. Drug repurposing during the COVID-19 pandemic. One of the most notable successes of Benevolent AI came during the COVID-19 pandemic, when the company used AI to identify existing drugs that could be repurposed to treat the virus. As the pandemic spread rapidly, there was an urgent need to find viable treatments quickly. Instead of starting from scratch with new drug discovery, Benevolent AI's platform analyzed data from thousands of studies, patient records, and previous antiviral treatments to identify drugs that could potentially be effective against SARS-CoV-2, the virus responsible for COVID-19. Repurposing existing drugs. Benevolent AI's. AI algorithms reviewed a large database of FDA-approved drugs and cross-referenced them with known biological pathways associated with COVID-19 infection. The platform identified baricitinib, a drug originally developed for rheumatoid arthritis, as a promising candidate for repurposing. Baricitinib works by inhibiting an enzyme involved in inflammation, which is a key component of the severe immune response seen in COVID-19 patients. Example: Benevolent AI's AI system suggested that baricitinib could help reduce the cytokine storm, an immune reaction associated with severe COVID-19 cases. This recommendation led to clinical trials that ultimately demonstrated the drug's effectiveness in treating hospitalized COVID-19 patients, and it was later authorized for emergency use in the U.S. in accelerating drug development. The AI-driven approach used by Benevolent AI significantly shortened the drug repurposing timeline, enabling the identification of viable treatments in a matter of weeks rather than months or years. This accelerated timeline was crucial in the race to find treatments for COVID-19, ultimately saving lives and improving patient outcomes. Expanding drug repurposing potential. Benevolent AI's success in repurposing drugs for COVID-19 has opened new possibilities for repurposing existing treatments for other diseases. By using AI to analyze large data sets, the company continues to explore ways to find new applications for already approved drugs, reducing the need for long development timelines and minimizing risk. Conclusion: the future of AI in drug discovery. AI is revolutionizing the drug discovery process, making it faster, more cost-effective, and more precise. By predicting molecular interactions, optimizing clinical trial designs, and repurposing existing drugs, AI is accelerating the development of new therapies and improving the likelihood of success. Companies like Benevolent AI are already demonstrating the power of AI in real-world applications, highlighting its potential to transform how drugs are discovered and brought to market. As AI technology continues to evolve and more data becomes available, its role in drug discovery will only increase, potentially leading to faster cures for a wide range of diseases, more efficient use of resources, and ultimately, better healthcare outcomes for patients worldwide. The future of personalized and precision medicine is being shaped by AI today, making it an exciting time for the future of healthcare. Section 2. Case Studies of AI Success Stories. Case Study 1. Google Health's AI for Breast Cancer. How it works. Google Health's deep learning system analyzes mammograms and helps detect breast cancer in its early stages. Trained on a dataset of thousands of images, the AI algorithm can identify cancerous tissue more accurately than radiologists, reducing the number of false positives and false negatives. Impact. By using AI to supplement human expertise, the technology has shown the potential to improve diagnostic accuracy and reduce the need for unnecessary biopsies, offering patients quicker and less stressful diagnoses. Case Study 2. Tempus and Precision Oncology. How it works. Tempus uses AI to integrate clinical and molecular data, helping oncologists develop personalized treatment plans. Through analyzing the genetic makeup of tumors, Tempus can suggest the most effective therapies and clinical trials for patients, improving treatment outcomes. Impact. Patients are receiving more targeted therapies, leading to fewer side effects and improved survival rates. The platform's data-driven approach has also streamlined the decision-making process for oncologists, making it easier to select the right treatments. Case Study 3. ADOC in Emergency Radiology. How it works. ADOC's AI platform scans CT images for critical conditions like brain hemorrhages and cervical spine fractures in real time. The AI prioritizes urgent cases and provides doctors with a quick, detailed analysis of the scan, ensuring immediate action. Impact. In high-pressure emergency departments, where time is a critical factor, ADOC's system allows healthcare providers to make faster and more accurate decisions, potentially saving lives in critical situations. Section 3. Ethical Considerations and Challenges. Bias and Fairness in AI. Challenges with biased data. AI models can perpetuate or even amplify existing biases if they are trained on biased datasets. For instance, AI trained primarily on data from one demographic group might underperform when applied to another group. This could lead to healthcare disparities, particularly for underserved populations. Mitigating bias. Ensuring diversity in training datasets is key to addressing AI bias. Regular audits, transparency in model training, and ongoing updates to datasets can help reduce bias in AI healthcare applications. Data privacy and security. Challenges of handling sensitive data. Patient data is highly sensitive and must be protected from unauthorized access. AI systems that use this data must adhere to strict privacy regulations, for example, HIPAA in the US, to ensure patient confidentiality. Safeguarding patient privacy. Encryption, anonymization of data, and data sharing protocols must be in place to ensure that AI systems protect patient privacy while still providing useful insights to healthcare providers. Accountability and transparency. Responsibility for AI errors. If an AI system makes an incorrect diagnosis or treatment suggestion, it is unclear who should be held accountable: the AI developer, the healthcare provider, or the hospital. Establishing clear accountability frameworks is crucial to ensuring AI is used ethically in healthcare. Section 4. Future predictions. AI's future role in medicine. AI as a partner to healthcare providers. AI will continue to evolve as a trusted assistant to healthcare professionals, not a replacement. AI will support clinicians by providing faster, more accurate diagnostics, enabling them to spend more time on patient care. AI-powered surgery, robotics, and precision surgery. The next generation of AI-powered surgical robots will take precision surgery to new levels. They will assist with even the most complex procedures, using real-time data to make adjustments during surgery, minimizing human error, and improving patient recovery times. Conclusion: AI is poised to transform healthcare in profound ways, from improving diagnostic accuracy to personalizing treatment plans and accelerating drug discovery. As the technology matures, challenges like ethical concerns and data privacy must be addressed